There are two procedures by which we can treat carotid artery stenosis or the blockage of the carotid artery. One traditional one has been doing open surgery in that area, where a surgeon makes an incision in the neck, opens the carotid artery, takes out that plaque and then places stitches to close the carotid artery and the skin incision. This procedure is known as endarterectomy. Another way to treat is that we go through the leg blood vessel by minimally invasive means without doing an open surgery and do angioplasty or stenting of the carotid artery. Both are useful techniques, both are pretty successful techniques. Major studies have shown that both have low complication rate. The biggest such study was done, which was known as CREST study, CREST, which was done in USA, which was the largest such study done comparing both the techniques. And CREST study showed that thankfully both are equivalent. But there are some important features which have come out later on. As the time has passed by, the technology keeps getting better and our carotid artery stenting results are getting better with time. So what researchers have found that in the second half of the CREST study, the stenting complication really dropped and actually stenting had better outcomes than open surgery. Secondly, open surgery can lead to a lot of complications in the neck incision site, such as hematoma and cranial palsies, which were not evaluated in these various trials. Also, there has been a major worry, like in heart, whether if you just place a stent, whether it leads to a repeat blockage in future. Well, surgery which takes out the plaque doesn't lead to a repeat blockage. Now here also thankfully the results have shown that long term the chances of repeat blockage remain the same in both the arms, whether do surgery or stenting, and thankfully the chances of repeat blockage in carotid artery are extremely low, less than 10% or around 5% or so. Also studies have shown when the blood vessels are straightforward, that means patient is not very old, blood vessels are straightforward, then stenting is a safer technique to do. So in our center, and it has been done in major other centers as well, most of these patients we treat by carotid artery stenting. But if we feel this patient is high risk for stenting, if blood vessels are very tortuous or there are some other issues by which we feel that surgery is better, then we refer them to surgery. Another important point is studies have shown that surgery leads to more stress on heart, which is very understandable. Therefore, patients have got more chances of cardiac issues happening during open surgery. So any patient with previous history of cardiac trouble, anyway we prefer to do stenting rather than open surgery in these patients. And lastly, it is not the technique, the doctor is also very important. So studies have shown that when carotid artery stenting is done by neurointerventionist, now stenting can be done by cardiologist or peripheral radiologist, but when it's done by dedicated neurointerventionist, then the complication rates are the lowest.